Welcome to Pedo Teeth Talk, brought to you by the American Academy of Pediatric Dentistry, a podcast show that delivers cutting-edge ideas for the professionals specializing in pediatric dentistry.
Thank you for tuning in to Pedo Teeth Talk, where we bring you the contemporary issues important to you and your practice. Brought to you by the American Academy of Pediatric Dentistry. I'm your host, Joel Berg. And thank you to our Pedo Teeth Talk sponsor, Ep.48, for helping us bring you great content. We couldn't do this without them. Visit them at www.epd.com. That's hu-friedy.com. We're here today with Ellie Wetzel to talk about therapy dogs in dental practice. I'm so excited about this. Ellie Wetzel is a licensed attorney based in Nashville, Tennessee. In fact, our annual session, which would have taken place in May of this year in Nashville, had we been there, we would have seen not only Ellie in person, but Winnie, her therapy dog, and at the conference. But I promise you, we're going to see Winnie and Ellie together in person real soon. Ellie has a dedicated career to the judiciary, working for state and federal court judges, where she performs legal research and writes court opinions. Ellie is also a registered therapy dog handler through Pet Partners, the national leader in animal-assisted interventions. Ellie and her Great Pyrenees, Winnie, are regular visitors at the Monroe Carroll Jr. Children's Hospital at Vanderbilt, where they have visited with children in the inpatient unit and the emergency department. They also visit at the Davidson County Juvenile Detention Center and Foster Care Review Board and make appearances at special events such as college exam weeks. Ellie is one of the founding members of Music City Pet Partners and serves on its board of directors. After becoming a therapy dog handler, animal accommodation law has become an area of personal interest to Ellie. She speaks to attorneys on laws concerning service animals and emotional support animals, as well as with dentists, sharing tips on how to incorporate therapy dogs into practice. With her background in law and training as a therapy animal handler, she is uniquely qualified to discuss risk management issues as well related to incorporating animals into practice, and as well as the role of training of therapy animals. So, Ellie, thank you so much for being here today. I was so excited when you agreed to do this because I'm a dog lover. Most of us are dog lovers. We know a little bit about the subject, but you're going to be the expert who tells us the real thing. So thanks for being with us.
I am thrilled to be with you. This is one of my most favorite things to talk about. So I love talking about dogs, and Winnie is just sad that she wasn't able to join us this time.
Well, we're going to hear a lot more from Winnie, and I talked to you previously that I'm interested in the Great Pyrenees, so you're also an expert on that as well. So the benefits, I want to kick right off with talking about, you talked about various venues in which you've worked, ranging from children's hospitals to dental offices to, I was intrigued by students taking final exams, all stressful situations, and how the common theme being alleviating stress. So what are the benefits of animals in healthcare facilities and dental practices? I seem intuitive and obvious, but maybe tell us more specifically what the benefits are.
Sure. Well, one thing that I've noticed is whenever, I bring my dog into a room, sort of people immediately light up. Having a dog present just sort of changes the energy, sort of makes people just sort of take a breath and relax, open up some communication. But then there's also empirical evidence to show that even particularly in healthcare settings, that the presence of a dog can decrease anxiety and stress, can even decrease perceptions of pain, help be a mood booster, and decrease worry. And generally, actually, some of the research shows that just 12 to 15 minutes in the presence of a dog will actually affect your biomarkers and can show physiological changes that are measurable in the studies.
Wow, and you gave me a whole bunch of data, and when we post this, we're going to tell everybody about the various sources of information that you've given me, and there's a tremendous amount of information. Yet there's also room for more research, and we're going to talk about that in a few minutes. I want to ask you also about therapy dogs versus service dogs and emotional support animals. We hear about, people taking various animals on airplanes with them. What is the distinction, the difference between those three, therapy, service, and emotional support animals?
Well, it gets confusing because sometimes those terms are used interchangeably, but they're definitely distinct categories of animals. And with therapy animals, they are generally personal pets that, based on their temperament and their training, they've been deemed safe that they can provide comfort to others. So they actually work on behalf of others rather than their own handler, and that's one thing that distinguishes them. About 95% of the therapy animals that are currently out there are dogs, but there's actually 9 species that are eligible to be credentialed as therapy animals. Dogs, cats, rabbits, miniature horses, alpacas, llamas, even domestic rats, guinea pigs, miniature pigs, and birds. So it's quite the variety.
Wow.
Now with service animals, they are actually trained specifically to do work for their handler who is an individual with a qualified disability. And it's because of their specific training that they're allowed to be in public places. And actually, I'm not sure if many people know this just because there's so many reports out there of all these different, animals trying to get into public places. But the Americans with Disability Act regulations limit service animals specifically to dogs only, but there is an exception for mini horses in some instances. So no other animal other than dog or mini horses can be in public spaces. So as a dental office, you wouldn't have a legal obligation to allow entry to any other species under the ADA.
Okay. Does that include like airplanes? Because I hear stories in the news about people bringing other species besides dogs onto planes.
Right. And the Americans with Disability Act doesn't apply to planes. They have their own specific laws, with the purpose being that, there's this metal box in the sky that, you might have to have different regulations. But counterintuitively, the Air Carrier Access Act has been interpreted to allow more animals. And that's actually undergoing revision changes right now. And by 2021, you probably will not be seeing emotional support animals on planes. An emotional support animal is actually a pet prescribed by a mental health practitioner, and it needs to be for someone who has a recognized mental health disorder. And the emotional support animals don't require any specific training. It's just their mere presence that can provide a positive and therapeutic impact. And so some healthcare facilities, because they want to, accommodate their patients, will allow emotional support animals to come in, but it's not legally required to do so. So that's something as a dental practice that you'll want to think about and determine whether or not you do want to allow ESAs to come into your practice or not.
That's very interesting, and thank you for that clarification. So now we're going to focus our attention on the topic of interest today, which is the therapy animals and therapy dogs and other animals and practices. So how does one go about doing this? And we're going to talk for a little bit here about the process of acquiring one, sourcing, risk management. And let's talk first about the liability, because I think one thinks about, if I'm going to bring an animal into my office, what kind of legal exposure do I have, and what should I be thinking about in that regard?
Well, the main thing that you'll want to make sure is that you're covered insurance-wise, and it is pretty difficult to find a liability carrier that will cover basically therapy animals or any type of animals in practice. And part of that's just the misunderstanding that a lot of insurers don't really know the difference between the animals and their training and what they can do. And that's something that Pet Partners has been working on in the last 2 years, has been doing a lot of research and gathering data with the hope that in 2021, when they launch a professional services line, that might be able to include professional liability insurance. But in the interim, if anyone does have questions about how to obtain an insurance carrier, Pet Partners National is welcome anyone to contact them, and they can give you lists that they know will cover animals in professional settings.
So you would recommend then specifically that one have additional or supplemental insurance for a therapy dog beyond their professional liability insurance?
I would recommend that at least checking with your current provider to see if they will cover animal-related incidents. Some might already do so, but now if you have a therapy animal, there's a couple different options, because if you have a volunteer come in, generally volunteers with the major therapy animal organizations will bring their own insurance. Of course, as you probably know, basically anyone can sue anybody over anything. So,
right.
So you may not technically be legally liable on the merits of the case, but just for your own protection, just to know that you do have that insurance. And that's true if maybe you bring your own personal dog just to come in, who isn't a therapy dog, but just some dentists I know bring their family dog into practice. If someone were to trip over them, or if they were to wag their tail and knock over some of your expensive equipment, things like that. And if you include emotional support animals in your practice, you definitely will want to ensure that you have insurance coverage for that.
As I've learned, and I'm here talking to a lawyer here today with you, Ellie, but our legal system is not so much about right or wrong, but somebody doesn't like it. So they,
Yes.
that's right. It has very little to do often.
Mitigating the risk is the goal.
Yeah, because I'm thinking, and you just referred to it, because I'm thinking about risk, and these therapy animals, these therapy dogs are some of the best trained dogs there are. And so I'm trying to imagine, you just mentioned accidentally tripping over them, but that could be any object in the office. I mean, what risk really is there?
Bringing a dog into the office, you're saying?
Yeah, into the practice.
Well, hopefully with therapy animals, that they have been trained and desensitized to the environment that they're working in, that, the likelihood of a bite or something should be low. Of course, animals are animals, so you can't always rule that out. But with the training and making sure that you have a handler who's solely focused on the animal, I've heard in some practices that maybe there won't be an actual person assigned solely to the animal and observing the animal. They might actually be trying to help the dentist. It might be the hygienist who's helping with the cleaning, but also observing the animal. You want to make sure that there's a dedicated person with that animal, whether it be a volunteer animal handler or if you have someone in your practice that is helping you.
So regarding that, the volunteer, go back to the nomenclature for a minute. You talk about volunteer animal handler versus your own dog, Winnie. So in some cases, could it be the dentist's or a staff member's own dog that is trained, or how does that all work?
Definitely, yes. So basically, the way it works is therapy animals have much less training than, say, a service animal. And so the key is really temperament, to make sure that the dog has an outgoing personality and is very interested in people, not just that they'll tolerate them. And then having a solid obedience training. And for the therapy animal evaluations, most of the therapy animal organizations follow the American Canine Citizens test, which is for the Canine Good Citizen test. So that is something that's commonly trained by obedience and professional dog trainers. And once they receive that level, then it's something you can consider to go on to actually test and become a therapy dog.
That's really interesting. We will now pause for a word from our sponsor.
Hugh Freedy is the global leader in dental instrument manufacturing, offering pediatric restorative solutions that keep you performing at your best. For more information on Hugh Freedy products, visit www.hughfreedy.com/AAPD-crowns.
We're back with Ellie Wetzel, who is telling us about therapy dogs in dental practices. It's really interesting. And I want to talk to you about sourcing if I want to get a therapy animal into my practice. But before we talk about that, I wanted to kind of paint a picture of expectations in terms of what specifically is the therapy dog going to do in the practice. In other words, in the encounter with the child, with the parent, give me a sort of a typical scenario that would describe how this interaction, dog, patient, parent, caregiver, dentist, how that works.
Sure. There's multiple ways that you can incorporate a dog into a dental practice. Probably the lowest risk way would be in the waiting room to kind of comfort and calm people while they're waiting for their procedures. Pet Partners has partnered with a lot of the mobile dental units for veterans, and that's where they'll have the dogs while people are waiting to have their procedure. Or you could actually incorporate the dog into the procedure itself and have the dog in the room, either on the lap of the child or on the floor. If it's a big dog, could be standing where they could pet the dog. For smaller dogs, sometimes people will put them in strollers and then kind of wheel them up so they can be at the child's level, but not necessarily on the child. And so there's actually a variety of ways that you can incorporate them that would be completely up to how your practice is set up and what kind of your goals are with incorporating the dog.
Are you familiar with scenarios where the dog is actually present during a restorative or surgical procedure, where they interact somehow, or the presence is calming?
Yes, I mean, that is possible. You want to make sure that the dog is used to the sounds and scents in a dental office, just to make sure that they won't be spooked by any of the, like the suction or the drill or any of those sounds before, you let them be actually in with a procedure.
Okay. That sounds exciting. So I'm now interested myself in having heard this from you today, Ellie. I'm now interested in getting a therapy animal, a dog, for the practice where I work. How do I go about sourcing? What do I do to find in my local community, or where do I go to get a service, not a service animal, a therapy animal?
Right, right. Well, it's very exciting. There are now nearly 200 individual therapy animal organizations nationwide, and that doesn't even include the chapters or affiliates of the national and regional therapy animal organizations. So there are a lot of organizations out there, but it is an unregulated industry. And so if you go to the American Kennel Club's website, they will have a list of about the 200 different ones that are in different locations. There's three primary national ones, Pet Partners, with which I'm most familiar, Alliance of Therapy Dogs, and Therapy Dogs International. And if you go to their websites, you can contact them and see if there's volunteers in your area who would be able to come visit your practice. You do want to check, because there's such a wide range of therapy organizations, confirm with them what their training practices are, what their insurance coverage is, and make sure you get a copy of that certificate. But that would be one option to bring in. Or if you wanted to have your own dog become a therapy animal, any of those therapy animal organizations actually do test and evaluate. And so you could contact any of those. I'm, like you said, most familiar with Pet Partners, and I can tell you about the practice that Winnie and I went through as far as how we became a therapy animal team.
Oh, I'd love to hear that. Could you briefly tell us about that?
Sure, sure. Winnie, even as a young puppy, just really expressed interest in people, and I was trying to find an activity for her. So she's actually who introduced me to therapy animals. I had called the Children's Hospital because I knew we wanted to visit there, and they referred me to Pet Partners, which is one of the primary organizations for healthcare facility therapy animals. And what you do is they have a handler course. The training is primarily for the handlers, so you can learn to read your dog's body language, become aware of zoonotic disease transmission, and also gain skills on best ways to interact with the people who you're interacting with. The handler course, at least for Pet Partners, can be taken online or in person, and you can actually take it up to 2 years before you test. So if you wanted to go ahead and take the handler course now while you're working with your personal pet to kind of get a feel of what's the expectations are, that's possible. Then when you feel that your dog has solidified the basic obedience skills and can pass the test elements on that Canine Good Citizen test, that's when you'll be ready to take an evaluation, which it's a team evaluation. The score is based on how you and your animal interact. While not super common, it is possible sometimes for a dog to pass and the handler to not, or vice versa. So
Right.
it's a team effort. And then you will get your credentials. Generally, for most therapy organizations, you do need to renew your credentials every so often, recommended about every 2 years, just to make sure that you're still up with the skills and that the animal still shows interest in wanting to visit with people.
That's fantastic. Now, are there certain breeds of dogs that are more suited towards being therapy animals?
There really isn't. Like for service animals, they do focus on specific breeds for different purposes. But for therapy animals, really any breed of dog, they don't even have to start as a puppy. I know one of our team members, the dog started at 10 years old, had really good obedience and really interested in people. And so they took the test and now visit. And rescues make amazing therapy dogs. So it doesn't even have to be, a purebred. It could be any kind of dog.
Oh, that's great to know. I think that dispels a lot of rumors, perhaps, the distinction there with service and therapy as well. So the last part of our conversation today, Ellie, I want to talk about research. And you mentioned all the great things at the outset here about what therapy dogs can do in easing anxiety and stress, which are commonplace in the dental office setting. You also talked about data and you talked to me about decreases in catecholamines and cortisone levels, blood pressure levels, perceptions of pain. Talk to us in the last moments here, please, about research and also what's missing and what research you would like to see, because I think there's going to be an interest in our listeners today in conducting some of that research, and including some of our residents who are looking at studies for the purpose of their education related to therapy dogs in the pediatric dental office.
There is definitely a lot of research out there about animals in healthcare facilities in general, and HABRI, which is the Human Animal Bond Research Institute, has the largest database of all of those studies, so that's a great resource for you to see what's already out there. There is little empirical evidence as far as dogs in dental practices. The first study was conducted in about 2000 and didn't show any statistically significant differences in behavioral stress, but it did demonstrate the feasibility of animals in a practice. And there's been some studies since, and actually last year two came out, one dealing with children and one dealing with adults, which was the pilot study for adults. And both of those shows positive results, but there's definitely a need for more research. Probably the best resource, there's an article that came out actually this year about hazards and practices in bringing a therapy dog into your dental office, and it would be a great resource, a great place to start.
Well, that's fantastic. We're going to try to get that from you, and I will get that from you, that reference, and we'll post it for everybody. Is there anything else you'd like to say to us today in terms of maybe words of encouragement or what frustrations there may be along the way for those who are interested in either being a handler for a therapy dog or to having one in their office?
Well, I know we talked about liability and mitigating risk, and I don't want that to scare people away, because the effects that I have seen just when I bring Winnie to visit the children is just transformative and magical in a way. And so definitely I'd say it's something to consider. Usually the risk is pretty low, but to make sure that you have written policies in place and protocol, and there are lots of resources out there, because therapy dogs have been incorporated in healthcare facilities for decades now, that those resources can be used to create policies for dental offices.
It's fantastic. Well, I know those of us, which is most of us, I believe, who are dog lovers, know that dogs are the best therapists. So they should also be the best therapy dogs in dental office settings. Thank you so much, Ellie, for sharing your wisdom with us. And we're going to be in touch with you, and we're going to get you and Winnie together at an annual session and
we would love
talk
that.
more. Yeah, and I'd like to see how we can help you and help ourselves by conducting some research and looking at this, because we talk a lot about stress and anxiety today, in particular with the COVID pandemic. And, stress is always there in a pediatric dental office. So we need to focus on what we can do to attenuate, to alleviate some of that fear. So thank you so much for being with us today. I appreciate it.
Thank you.
And thank you for being with us on Pedo Teeth Talk, where we bring you the contemporary issues important to you and your practice. We'll see you here next time.
Do you need additional CE hours but don't have time to travel to courses? Did you attend annual session and want to listen to the audio recordings? Check out AAPD's new Education Passport. The redesigned and improved Education Passport is AAPD's online learning center, where you can earn CE and listen to audio recordings from all of our continuing education courses and more. Visit educationpassport.aapd.org for more information. For 10% off any product, use discount code TEETHTALK in the Education Passport store.
Pedo Teeth Talk is brought to you by the American Academy of Pediatric Dentistry, the show that delivers cutting-edge ideas for the professional specializing in pediatric dentistry. If you have any questions or comments, please email info@aapd.org. We welcome your ideas for future shows and guests. For more information on the American Academy of Pediatric Dentistry, visit aapd.org.